Hello everyone, thank you for joining me today. In this training, I will be presenting on ethical challenges that professionals in the mental health wellness field frequently encounter. Specifically, we will review conflicts of interest, how personal values can influence professional decisions, the ethical principles that guide our practice, and examples of common ethical dilemmas, along with strategies for resolving them. These issues are important because our professional decisions directly affect client trust, safety, and overall well-being. Here is the agenda for today's training session. First, I will explain two concrete examples of conflicts of interest and how they might present themselves in mental health and wellness practice. Next, I will describe how our personal values can sometimes conflict with decision-making and how those conflicts can impact clients. After that, we will look at the ethical principles used across professional codes of ethics. Finally, I will show two examples of ethical dilemmas that may arise in the practice and discuss how to navigate them responsibly. The first conflict of interest I would like to highlight is the issue of dual relationships. A dual relationship occurs when a counselor or a wellness professional has both a professional role and a personal connection with a client. For example, imagine being asked to provide counseling to a friend, a neighbor, or a family member. In this situation, boundaries between the professional and personal relationship often become blurred. This makes it difficult to remain objective, and it can compromise confidentiality if private information is accidentally shared outside the counseling setting. In my own area of practice, this type of conflict could easily present itself in a small community settings where professional and personal circles often overlap. A second type of conflict of interest involves financial incentives. For an example, a professional might refer clients to a particular treatment program or wellness center in exchange for a referral bonus or some other benefit. While this might appear to be a routine practice, it arises serious ethical concerns. The client may question whether the recommendation is being made because it truly benefits them or because the professional stands to gain financially. Such conflicts damage the trust that is essential to the client-professional relationship and can make clients feel exploited. In my own practice, I would need to be careful to ensure that referrals are always based on client needs, not personal or financial gain. Our personal values inevitably influence the way we approach counseling and decision making. One example is working with clients who struggle with substance abuse. A counselor who personally believes in complete abstinence might find it difficult to support a harm reduction approach, where the goal is to reduce the risky behaviors rather than insist on full sobriety. The counselor allows their personal values to dominate. It can make the client feel judged or unsupported, which could harm their progress. Another example arises when working with clients from cultures with values different from our own. For instance, some cultures may value arranged marriages or have specific expectations about gender roles. If these values conflict with our personal beliefs, ethical practice requires us to remain culturally sensitive and prioritize the client's well-being. In both situations, self-reflection, consultation, and adherence to professional codes of ethics help ensure that clients' needs remain central. The mental health and wellness field is guided by a set of core ethical principles outlined in professional codes of ethics such as those from American Counseling Association, the American Psychological Association, and the National Association of Social Workers. Autonomy emphasizes respecting the client's right to make their own decisions. Beneficence requires us to actively promote the client's well-being. Non-maleficence obligates us to avoid causing harm. Justice emphasizes fairness and equal treatment across clients. Fidelity focuses on building trust, keeping promises, and maintaining professional responsibility. Finally, veracity is about being truthful and transparent in all professional interactions. Together, these principles provide a framework that helps us make ethical choices when faced with complex or ambiguous situations. One common ethical dilemma is the conflict between maintaining client confidentiality and fulfilling our duty to warn. For example, a client may disclose that they intend to harm another person. While confidentiality is central to the counseling relationship, our ethical and legal duty to protect others requires us to take action. In such cases, the counselor must break confidentiality, but only to the extent necessary to prevent harm. This may mean notifying law enforcement or the intended victim, but it does not mean sharing unnecessary details. This dilemma requires careful judgment and often consultation with supervisors to ensure the right balance between client privacy and community safety. A second ethical dilemma involves the issue of professional competence. Imagine a client comes in with severe trauma symptoms, but the counselor has not been trained in trauma-specific interventions. Ethically, counselors are required to practice only within the boundaries of their competence. However, turning the client away without support could also cause harm. The best course of action in such situations is to provide initial support, seek supervision, and refer the client to a specialist who has the appropriate training. At this same time, the counselor might pursue additional training in trauma care to expand their competence for the future. This dilemma highlights the importance of ongoing professional development in collaboration with colleagues. When faced with ethical dilemmas, there are several strategies that professionals can use to navigate them responsibly. First, self-reflection helps us identify our own biases and values that might interfere with objective decision-making. Second, consultation with supervisors and colleagues provides outside perspectives and guidance. Third, using established ethical decision-making models can help us systematically evaluate the situation and identifying the best course of action. Finally, committing to lifelong learning, including continuing education and cultural competence, ensures that we are always developing the skills we need to serve clients ethically. In conclusion, ethical challenges are an unavoidable part of working in the mental health and wellness field. We must recognize conflicts of interest when they occur, manage our personal values so they do not interfere with client care, and consistently apply professional, ethical principles to our work. When dilemmas arise, we must navigate them carefully using reflection, consultation, and established guidelines. By doing so, we uphold our responsibility, protect clients, build trust, and promote overall being. Thank you for your attention to this important topic. These are the scholarly resources I used to prepare today's presentation. They provide further depth into ethical principles and decision making in the mental health and wellness field.